everybody, and welcome to this much awaited webinar on COVID vaccine, where all of your doubts and concerns will be cleared. So, given today's climate and our environment, there is so much information that is floating around about COVID and the vaccine, whether to take it or not, its side effects. And at a time like this, it is incredibly important to have medically accurate information on hand. So I know we're all extremely excited about this webinar. So before don't want to delay it any further, so let's begin. And most importantly, let's introduce our speaker today, which is Dr. C.H. Asrani. So, like I said, we'll begin with a short introduction of Sir. Dr. C.H. Asrani brings to the table extensive experiential knowledge across 43 years of active clinical practice and training individuals across wellness management. Sir has successfully explained patients on various aspects of health and wellness. Over the years, Sir has dissipated his knowledge via numerous programs and editorials, educating and benefiting lakhs of people, which include over 500 blogs, 1,000 tweets, and 200 posts on Facebook on wellness. Of course, even during this entire lockdown period, Sir has been disseminating information regarding various topics, and all of them have been extremely well received. They are very, very easy to understand, to follow, to listen to. And as always, it's an incredible source of knowledge. So I'll hand over to Sir, and thank you so much, Sir.
Thank you, Shrita, for those nice words. Why are we having this webinar today? All of us have taken vaccines. We even take vaccines in adulthood. All have given vaccine to our children, grandchildren, and we never had any doubts about any vaccine. What has happened with COVID is another bunch of doctors have been qualified. All they have to do is forward 100 messages on social media and they become doctors. There is so much of misinformation, misguiding going on that I thought that I should organize one such, and then several of my patients who are very close to me, they suggested that we should have one such thing. So let's begin. There are questions coming in. One of my team member will collate all the questions and we will answer all the questions as much as the time permits. COVID vaccine, all the doubts and concerns. Before I address certain questions which I have shortlisted myself because they are the commonest and my patients have asked me that, I will give you some information which I think as a consumer exposed to misinformation on social media, you have a right to know. COVID vaccine, what we must know. Let's begin with what is a vaccine. COVID vaccine is a type of vaccine. We have taken enough vaccines, polio, triple, human papillomavirus, influenza, pneumonia, whatnot. So a vaccine is a biological preparation that provides active acquired immunity. Now I will explain to you what is active acquired. Acquired is a generic word, everybody knows. You get it. You can get acquired immunity in two ways. One is you suffer from the disease and you have immunity against that disease, or you take a vaccine. What is active immunity? I'll explain to you as we go ahead. It provides this immunity to the person who's being vaccinated against a particular infectious disease. The vaccine is generally for one disease, but then as science advances, we have a combination of vaccines. We have a triple antigen, we have a penta vaccine which combines 5 vaccines, but actually it is a mixture of 5 vaccines which are also available separately. Before I understand or you understand what is a vaccine, let's understand what's immunity. Immunity comes from a Latin word called immunis. Immunis is exempt. So my body is telling me, exempt me from these ailments and give me immunity against these ailments. So immunis is exempt, protection against foreign agents. The integrated body system of organs, our body is an amazing example of how nature has, like, the best computer, supercomputer available. It is working non-stop from our first breath or even before the first breath in the mother's womb till the person dies. There is a system of organs, tissues, cells, and the product that cells come out with that differentiates self from non-self. Whether what is entering today in my body is mine or it is not mine. So immunity basic addresses only one question: to identify self from non-self and then neutralize potentially harmful organisms. If it identifies as self, it welcomes and hugs the thing if it is self. If it identifies as non-self, it stops it. Please wait. I don't identify you as a friend. And if there is the immunity against this particular organism that is coming in, it kills it. So my immunity will identify what is self, what is non-self, and react accordingly. Inside our body, we have an amazing system of protection called immune system. Now, those of you who are finding it difficult to understand, I am sure today everybody is using a computer or internet on the mobile. And on our computer, we install antivirus. If our work is very precious, if we are working on company machines, then we have a firewall. Just compare our immunity with this antivirus and firewall in the computer or the mobile, which is to protect our data, our machine from harmful agents coming in, wanting to destroy my data. We value our data, we don't value our body. So immunity is my power to fight against what is about to harm me, designed to defend against millions of microbes, bacteria, viruses, parasites that would love to come and invade us and cause different ailments. We don't realize the power of immunity till it goes away. You must have heard various friends saying, my immunity is low, I'm falling sick very often. That friend never told you, my immunity is good, I'm not falling sick. We always identify the absence of a powerful thing. Just imagine, how do we notice the absence? You have a cockroach in your house, you have ants in your house. No ant will come and attack the cockroach. The minute cockroach is dead, the ants will come out from wherever and drag the cockroach back. Even in human bodies after death, if the body is stored for a long time for relatives to come from overseas, you see insects starting to creep in. The power, only when it is not there, we identify. Let's see different types of immunity. The immune system consists of, first is my inborn immunity, what I am born with, what the body computer or supercomputer has immunity, that is my innate immunity or inborn immunity. And second is what I acquire in the process of my living. I give a child vaccine against hepatitis B, that is acquired immunity. I give polio vaccine, that is acquired immunity. I take a tetanus toxoid, that is acquired immunity. Acquired immunity can be of two types, active and passive. Again, I will show you the differentiation as we go ahead. Inborn immunity is made up of various parts in our body that protect us from various organisms. We have saliva in our mouth. The saliva has various enzymes which kill ordinary microbes. We have hair in our nostrils which block the organisms going in or dirt particle going in. We have lining of our intestine, stomach, which kill if any of the germs enter there. The hydrochloric acid in the stomach kills the germs. This is our inborn immunity. We are not acquiring it. It is there with us. We are born with it. The inborn immunity is general, non-specific. It is like if you are staying in a colony of 5 buildings and there are 2 watchmen on the gate, that is your inborn immunity. That is general. It is not for you. It is not for a particular disease. It is general. So we need to have specific immunity. Now that newer bacteria, newer ailments are coming up regularly, we need to have immunity against them. Acquired immunity now. Inborn immunity we understood. Active and passive. Passive is something you get without doing any effort. Active, you are doing some effort. So active is of two types, natural from a disease. So a person who gets chicken pox at whatever age in life has immunity against chicken pox for rest of the life. And the person who does not have chicken pox is given a vaccine, then has vaccine related immunity against chicken pox. If the immunity has come after having suffered chicken pox, that is natural acquired immunity, natural active acquired immunity. And if it is through a vaccine, it is artificial active acquired immunity. So all vaccines are going to be artificial active acquired immunity, because end of the day, I am introducing an agent in my body and my body reacts to that agent and creates immunity within me. I'll give another example. I'm sure many of you have not gone to police stations, but you must have seen pictures of police station in movies or serials. There is a wall on which several photographs are put of known criminals. Understand that picture is in your body, that is my immunity. So if I am giving a vaccine against chickenpox, my body identified chickenpox from that image, and next time chickenpox virus will enter my body, it will be eliminated. So it is giving a immune memory, which either will last for few months, years, if you need a booster, or for rest of your life. And then the information is not available when the vaccine starts. Like when hepatitis B vaccine started 30 years ago, we were told that every 5 years you need a booster. But then the research said no, 3 doses given, lifelong immunity. So then that immune memory is created. Again, I'm repeating, if you suffer from a disease, so for corona or COVID, people who have suffered from corona, they have IgG positive, that is indicator of immunity. Now, how long that lasts, nobody knows, because it's a new disease. Should they take vaccine? Yes, they should take vaccine 3 months after the disease. And those who are not suffered from COVID, are taking vaccine against COVID are getting artificial active acquired immunity against COVID. What is passive immunity? Natural through breast milk. Mother, whatever immunity mother has, she passes on to the child because till the child is vaccinated or becomes big enough, because the immunity totally develops after 6 to 8 months, mother passes immunity through the milk. If you remember, all pregnant women are given 3 shots of tetanus toxoid in 7th, 8th, and 9th month of pregnancy. This is to give immunity to the child till the child is given a triple shot. And passive is direct immunoglobulin. Now, as I said, that those who have suffered from corona, a blood test is done, IgG. IgG is an immunoglobulin which we measure to understand whether the patient has immunity against corona or not. Now, I don't know how many of you read newspapers, but US President Trump, when he had coronavirus infection, he was given a cocktail of antibodies to fight against the virus. That was artificial passive immunity. We gave ready-made immunity to him. Similarly, we give such passive immunity, artificial, in certain cases where you have a very bad dog bite or a horse bite, or you have certain serious infections, there we give this, but it is not used much. We don't give immunoglobulins that often. I hope this is very clear. And now, while giving COVID vaccine, we are trying to build up our artificial active acquired immunity. Now, there are a lot of vaccine names coming up. Suddenly, everybody is become knowledgeable. People are talking that these vaccines are not safe, that vaccine is not safe. So let me give you an idea of how vaccines are made. First is live attenuated vaccine. Attenuated means it's a medical word for weakened. So if I am preparing, suppose, a vaccine against COVID, I have a live COVID virus which I have made weak so that it cannot cause disease. And then I introduce that into the body with a hope that the body will create immunity against COVID. Live vaccines use weakened form of the germ that causes the disease. Since these vaccines are similar to the natural infection that occurs, that they are helping prevent now, they create a strong and long-lasting immune response. Those of you who are here in 60 plus age group will remember that in those days, a smallpox vaccine used to be given on the shoulder, which would create a blister like a smallpox thing. That was a live attenuated vaccine. Just 1 or 2 doses of most live vaccines can give a lifetime protection against the germ and the disease that it causes. Common examples are MMR, chickenpox, yellow fever, rotavirus, and now for COVID, what is indigenously made in India, Covaxin, which is undergoing third level trials. Then inactivated vaccine. Here, there I have a live virus which has been weakened. Here, inactivated vaccine has taken the virus, killed it, and now anticipation that if the killed virus also has its material and it's going to create immune response. Immunity not as good as live attenuated vaccine. Common examples are hepatitis A, polio, influenza, and rabies. None of the COVID vaccines are of the inactivated type. Then I have a special vaccine which is called a recombinant vaccine. I discussed 2 types till now. One is a live germ which is weakened. Second is a dead germ. Now, the entire germ does not cause disease. Some part of the germ causes disease. So these vaccines are created using specific pieces of the germ. It could be protein of the germ, it could be sugar, it could be capsid, various parts of the germ that one part is taken which is harmful, used to create a vaccine and generate response against that. I will explain with pictures subsequently. So this is a germ. I can take, one second, I'll show you. I can take just this. If this is going to cause problems, I'll pick up this and use it to make a vaccine. If this rod is going to create a problem, I'll take the rod. I may take the cell wall if that is causing it. And then I will create a vaccine out of that. Since these vaccines are using only specific pieces of the organism or the germ, they give a very strong immune response that's targeted to the key part of the organism. The plus point of these vaccines is they can be used on all people, including those who have a weak immune system and long-term health problem. So all the question that anybody has in mind now, I have asthma, can I take? I have this, can I take? I have just been treated for chikungunya, can I take? I had dengue, can I take? Yes, these vaccines can be taken by everybody other than those who are undergoing active cancer chemotherapy. A limitation of these vaccines is that it requires boosters, repeated boosters for ongoing protection against the disease. Human papillomavirus, HIV, hepatitis B, pneumococcal, meningococcal vaccine, and Covishield for corona is an example for this recombinant vaccine. Covishield is a recombinant vaccine made from a weakened version of a common cold virus. It's not taking coronavirus, it's taking common cold virus known as adenovirus weakened, and a part of that has been taken to prepare Covishield, and it is a virus from chimpanzees. It has been modified to look more like coronavirus, but one thing we assure you, it cannot cause illness. So all the newspaper report that you are reading, that one took vaccine and got COVID. That COVID came because the immunity had not yet built up. 2 doses were not over. Cannot blame people getting COVID after vaccine to the vaccine itself. No, it is a very fine scientific principle. Then toxoid vaccines. Every germ produces some poison which causes effects in the patients. These vaccines pick up that poison, that harmful substance, and create a vaccine out of that. They create immunity to the part of the germ that causes the disease instead of the germ itself. So immunity is now given. Suppose I have a tetanus bacteria which gives a poison called X. The tetanus toxoid will be targeted to have effect against X and not tetanus bacteria. It means the immune response is targeted to the poison or the toxin and not the whole germ itself. Tetanus and diphtheria are the examples. There is a new name around the block, mRNA, and that has become a fancy because in overseas countries, mRNA vaccines are used. mRNA, M stands for messenger. RNA is a complex subunit called ribonucleic acid. Talking of DNA, RNA is a full day topic. We'll not talk of that. Till now, no mRNA vaccines are available in the market, only for COVID. As soon as COVID infection came in, few companies started doing research to make mRNA vaccines. mRNA vaccine take the advantage of the process that cells, every cell is using proteins in order to trigger an immune response. All the immune, that IgG that I'm talking of, is a protein and build immunity to SARS-CoV-2. Pfizer and Moderna are two mRNA vaccines which are used in Western world. Now understand how vaccines work. When we said recombinant vaccine, using a part of it, this is the coronavirus, this is a graphical presentation, this is a vector diagram. Now if you see this spike protein S that I am highlighting by a circle, this protein causes the problem of corona disease or corona infection. Spike protein of SARS-CoV-2 plays a key role in receptor recognition and fusion process. So what happens is, see this. This is the virus. This is the host. Host is us. So understand this. This is like a cup. This ACE inhibitor connects with spike protein, forms fusion, and now through this fusion, disease enters in the host. So now if I have identified that this spike protein, the whole virus is useless if the spike protein is saved. So I create a vaccine against the spike protein only. Then that vaccine will send a message or neutralize the spike protein. Coronavirus cannot enter your body and cause disease. Now, there are a lot of questions about side effect. There are a lot of questions happening of forwards coming in, that doctors who got very severe sickness and all. We got a message of two doctors who suffered severe joint pains after the vaccine. And 1 week later, those doctors themselves write that both of them have been diagnosed with chikungunya. So everything that happens negatively cannot be attributed to coronavirus. It's like, you take vaccine, you come out, your car meets with an accident and you say, oh, I took vaccine and I met with an accident. It doesn't work like that. So these, what I'm showing you is what is released by the government of Maharashtra. Basic information, Covishield, in India, we have only 2 vaccines, so I'm talking of these only. Recombinant vaccine based on vector viral technology, adenovirus of chimpanzee. Covaxin is whole virus inactivated coronavirus vaccine. Not recommended in pregnancy, not recommended below 18, not recommended during lactation. Other than that, I am allergic to sulfa, I am allergic to this, I am allergic to that. Can I take? I am allergic to egg. Can I take? I am allergic to prawns. Can I take? Yes, everyone can take. I am a diabetic. When I took vaccine, they didn't ask me, are you a diabetic or not? Because all diabetics can take. Adverse effects following immunization. Covishield, injection site tenderness. Tenderness is pain on touch. Pain, some headache, some muscle pain, some fatigue, some malaise, feeling of dullness, feel like lying down, fever, feeling chill, joint pain, and nausea. Now, it is not that all of this will occur. All of this or some of this can occur. When I took with 7 of my clinic staff, none of us got any problem. One girl had a fever of 103, but that was because she had an acute cold. We just had a tiny soreness for 2-3 days where the injection was given, but nothing. So it's not that everybody will get these problems. No. Covaxin, if you see, they are similar. Injection site tenderness, pain, some swelling. Covishield doesn't say swelling. Headache, fatigue, fever, body pain, pain in abdomen, nausea, vomiting, some dizziness, some chakkar. tremor, some sweating, feeling of cold. Or you may get cold and cough because this is a attenuated virus. When should second dose be taken after first dose? The government has issued initially 4 to 6 weeks, but WHO now is talking of 8 to 12 weeks, but we are following here 28 days. A friend of mine who took first dose, it was given the second dose after 28 days. So again, whenever, as per the government recent recommendation, we will give vaccine second dose to people following the internationally or nationally established guidelines. Now, the biggest question is, should I take the vaccine? And the answer is yes. You should take the vaccine for yourself and for others. There's a term called herd immunity has become very powerful on social media. So if you take vaccine, it will help others. The biggest example of herd immunity, I will tell you all to remember the polio campaign, Rotary Club Pulse Polio campaign, which Mr. Bachchan was supporting. Every child in India was given polio vaccine, and that way we could eradicate polio from our country. Now, maybe after another 5 or 10 years, oral polio vaccines may not be available. So I'll take some time in explaining you what is herd immunity. Herd immunity, this is a definition by World Health Organization, also known as population immunity or indirect immunity. I do not have immunity within me, but people around me have immunity, so I am also benefiting. Is the indirect protection from an infectious disease. COVID is an infectious disease. Flu is an infectious disease. That happens when a population is immune either through vaccination or immunity developed through previous infection. This picture has been taken from Wikipedia Commons. Understand this, purple colored human shape is signifying not immunized but still healthy. Yellow colored human shape is immunized and healthy, and red color is not immunized, sick and contagious. So this is the population. This is the herd, HERD, and I have 2 COVID cases here. Everybody is healthy, but they have no immunity against COVID. And the disease spreads like this. After some time, you see only 5 are remained untouched. Maybe they are taking better precautions. Everybody else is diseased. Now, second option is some of the population get immunized. So if you see now here, we have 6 people who have taken immunity, same 2 COVID positive, 6 immunity. If majority of us do not take the vaccine for whatever fear or concern, then we have this stage where these 6 are saved and 5 more are saved, rest everybody gets, because herd immunity has not kicked in. These people have immunity, they will never get infection, others will get. Now I have the third scenario where large number take. Only 4 people do not take, everybody else takes. Here I have maybe out of from 2, I have 1 more infection here. And I have 3 people who don't have infection and they have been saved due to herd immunity. So when we take vaccine, we are not only benefiting our own body, we are benefiting the society, the country in totality. That is why smaller countries like Singapore or New Zealand or Luxembourg, they're talking of the entire country being immunized. That is herd immunity they're achieving. Now we are a huge country. We have problem of numbers. And we have people who are now talking that I will not take, it is not safe for me. Please understand, it is safe for you and you will be helping others by the concept of herd immunity. Then the second misinformation that has come, that vaccine is going to affect your genetic code. It is going to make people infertile. Is it true? It is the biggest lie ever generated. The vaccine never reaches the nucleus of the cell. The genetic material is present in the nucleus. A vaccine never reaches the genetic nucleus. It is only giving immunity against a certain part of the virus to save you. It cannot affect your genetic code. Just imagine if it was so simple. If it was so simple. There are today a lot of patients who have completed the family, or there are young couples who are getting married and deciding no kids. Why should they bother all their life about contraceptives? They go and take a shot like this who makes them infertile. It is somebody's vivid imagination. It's not going to happen. Your personality will remain like you. When will we receive the vaccine? I took this talk about 2 weeks ago. I said that time I am not an astrologer, but today our supplier has told us that within a month it will be available in open market. So let's presume 6 weeks from today it is going to be available. Please contact your family doctor and request to put you on the list when the vaccine comes. I am sure it's going to be in short supply. Please make arrangement for taking the vaccine. Who should not get the COVID-19 vaccine? I told you, people below 18 years of age, pregnant, lactation, active cancer chemotherapy going on. But I think it may so occur that when mRNA vaccines come to India, those may be where can we get the vaccine? Now that it has been announced that it will be available in open market, so either government will allow private doctors like me or other family physicians to give, or they will designate spots, hospitals and all. But the kind of information that the government has spread till now was wonderful. You will get to know immediately. I think for a minute my internet went, so I will repeat the last question. You keep your doctor informed that you want vaccine. As soon as it is available, you will be notified. What are the side effects of mRNA vaccine? I give side effects of those two. mRNA vaccine, because they are far advanced, the most common side effect is pain, soreness at injection site. But mRNA vaccine are still not available in our country. Can we take medicine for side effects after we get the vaccine? These two questions have been merged. Yes, if you have headache, fever, pain, you can take paracetamol. If you have too much pain at the injection site, you can apply ice. There is no need to take any antibiotic or stronger medicines. How should I make sure that the vaccine has worked? There is a test called ELISA IgG antibody test against spike protein of SARS-CoV-2. This you can do after the second dose, wait for 2 weeks and get it done then. What should I do if I took pain medicine before my first dose of COVID-19 vaccine? This question was asked by a youngster who was taking pain medication for some back problem. It makes no difference. If you're taking pain medicine, go and take the vaccine. You will not even require any medicine subsequently. These are all. Follow us on all these social media sites. Shrita, you will start questions. Can heart patients on blood thinners take the vaccine? As of now, for Covishield, there is no restriction. Covaxin, when it comes, there was a social media this thing, but when it comes, you can download the brochure from the internet and it will be there. The best person to guide you is your family doctor, whether you can take the vaccine or not. Will I be giving vaccine? Yes, I will be giving vaccine. At age of 80, yes. Is it safe? Yes, it is safe. The immunity may not be as strong because age is a indirect thing of immunity going down. You may not develop immunity as good as a young person, but yes, vaccine is safe. If anyone already has IgG antibody positive for COVID, still need vaccine, yes, it is better to take vaccine because you do not know how long this IgG will last. This IgG have either come to you after suffering COVID or through contact. Now you cannot check every month and then decide when to take the vaccine. So that is why the authorities have said that 3 months after the COVID infection, you can take or you should take the vaccine. Several doctor friends of mine, my age group, they suffered from COVID. They still took the first vaccine after 3 months. This presentation will be available on YouTube for a permanently. A lady stops lactating after how many months she can take vaccine? Very good question, very open-ended question. I think stopping lactation and making sure that the milk production is stopped, I would say maybe 4 weeks. 4 weeks should be sufficient. Shreeta, have you shortlisted the questions?
Yes, sir. I'll be asking you the question, sir.
Okay,
So
Preeti, yeah, we can start.
yes, sir. So the first question is, can a patient who has suffered from chikungunya take COVID vaccine? Patient
Yes,
tested positive
yes,
4 weeks
yes,
ago.
yes.
Okay. The next question is, 75-year-old, history of Parkinson's and on Syndopa. What is the procedure for vaccine?
Like another normal patient. The
Okay.
status of Parkinson has no difference in taking vaccine. Same dosage, same everything.
Okay, sir. So the next question is, for people above 50 and on statins, do we need to stop taking statins while taking the vaccine?
No. I continued statins and took the vaccine.
Okay, sir. Next
See,
question is,
one
yeah.
minute. As
Yes,
I've
sir.
explained how vaccines work, no, the drugs don't even come in the picture at all. Yeah,
Okay.
Preeti, next.
Yes, sir. Can a patient 70 years old taking meds for hypothyroidism and hypertension and has undergone thymectomy some 25 years back take COVID vaccine? How
Yes,
safe and effective will it be?
See, that is a Pandora's box, how effective it will be. Now I have two options. One, I say, oh, since I'm not sure how effective it will be, so I will not take. Second is, I will take and I will check my antibodies 15 days after the second dose. It's like, you cross the road. Half the time, 90% you don't meet with an accident. Sometimes, even taking all safety precautions, you are hit by a car. So the same thing you apply here. I will take all precautions that I can, and taking vaccine is the best precaution that you can take.
Okay, sir. So the next question is Covishield effective above 65 years? When should the second dose be taken?
See, currently for the doctors, the government will notify when you should go. They are giving it 28 days, that is 4 weeks. I think if you are being called, take then. Worst come to worst, when the vaccine is available in open market and your antibodies don't develop, you can take a second booster after 6 months. So, since the COVID disease is new, we have no idea how it is going. Today, to have all answers no is just not possible.
Okay. So the next question is vaccine safe for CAD patients, particularly the old ones?
Yes. See, all the ailments that are being asked no, these people have a higher chance of death due to COVID. Like day before yesterday, a patient died, 34-year-old, 134 kilo was the weight. morbid obesity is a very big risk factor for death in young people in COVID. So all these people have more of a reason to take COVID than healthy other adults.
Okay. So please, can you comment on Moderna vaccine from Pfizer?
No, I cannot. It is just that it is mRNA vaccine. It is working well. And if you are going to United States or Singapore and you get a chance to take it there, please take it. But make sure you are going to be there sufficient time to take second dose also. You cannot do that one dose Covishield here and then one dose Moderna there. No, it doesn't work. You have to take both vaccines the same type.
Okay. So the next question is 59-year-old female, non-diabetic, non-hypertensive, on pacemaker since 1996, on Theranorm 50 mcg since 1996, history of migraine. Can she take the vaccine?
Yes, she should take the vaccine.
Okay.
There
Does
was
someone
one question,
Yes.
Preeti, which occurred to me, which I am sure people will not ask.
Yes.
What about taking other vaccine and this vaccine? What is the gap? So normally, when we do not give two viral vaccines together. So if an adult, you are taking a viral vaccine like influenza, then I suggest you keep a gap of 2 to 3 weeks between the two, or you are taking rabies vaccine, you keep a different gap of 2 to 3 weeks. Otherwise, you can take a tetanus today and COVID vaccine today. There's no difference at all. Yeah, Preeti, please go ahead.
So does someone who already had COVID need to be vaccinated?
Yes.
Okay. So next question
3
is
months
it,
after the disease.
okay. So is it true that Covishield is not recommended for those planning to conceive in the near future?
I have not read that thing because it is not going to affect your fertility at all. I feel near future is like, okay, if to take second dose, you hold on for 6 weeks, and then at least there is a immunity even during pregnancy that you won't get COVID.
Okay.
Now, in this last 1 year, several mothers got COVID during pregnancy and we had tough time treating them.
So the next question is which antibody test should be done after the vaccine?
I showed on the slide protein S specific IgG antibody.
Okay. So herd immunity with respect to COVID vaccine, it may not affect transmissibility rate. So how will it help?
Will come again?
So herd immunity with respect to COVID vaccine, so it doesn't affect the transmissibility rate. So how will it help in herd immunity?
Okay, it may not give you herd immunity, it will give immunity to yourself.
Okay.
So at least for that reason, you take for yourself, be a little selfish.
Okay.
Now somebody has written, here in Amravati, we came to know that there is a new mutant N440K and E484K. Is the vaccine protective against it? No, we do not know. And understand one basic thing, everything is new. As time passes, like today, the HPV vaccine, cervical cancer vaccine that you take has effective against 4 variants. In Singapore, you have 9 variants. All our influenza vaccines are against 4 variants. So gradually, vaccines will be incorporated to have effective against those. But today, the commonest SARS-CoV-2, the vaccine is against that. I cannot risk myself saying that, oh, but it doesn't work against that mutant. Somebody asked me from Goa, this vaccine is not effective against South African mutant. So are you going to go South Africa? Are you sure you'll get there? At least take whatever is available, build some immunity. No, today you have no immunity against corona.
Yes. So how do we choose which vaccine to take, Covishield or Covaxin?
I will say whichever is available to you. Covaxin is still not available in market. They are still doing the field 3 trial. The day they get an approval and once it comes in market, all that rumor on social media, that government is hastening is wrong. all proper precautions are being taken. So once it comes in open market, it is available to you, both are safe. I would prefer Covishield.
Okay. So, 75-year-old operated for appendix cancer and taken full course of Folfix chemotherapy 8 years back and is pre-diabetic. So, should he be vaccinated?
Yes, he should be vaccinated.
Okay. So, 70 years old with mild COPD and mild asthma with diabetics, can he get the vaccine?
Yes, yes. All comorbidities which are risky for COVID, which have a higher chance of death, have to take the vaccine.
So the next question is, if vaccine is safe, if allergic to certain antibiotics, septum group and certain medication, so can the vaccine be taken?
Yeah, any kind of drug allergy, the vaccine can be taken. There's a question I read here. Can pneumococcal vaccine be taken along with COVID? Pneumococcal is a bacterial vaccine. Yes, it can be taken along with COVID.
Yes, sir. So, and the next question is, if a person is suffering from genital herpes for last 15 years, should he take this vaccine?
Yes.
And what about transplant patients?
I would only say here that transplant patient is undergoing under treatment of a transplant physician. Better to ask them.
Okay.
We want to give all these people immunity because a patient who's undergone a transplant is at a higher risk of getting these infections. I am sure they will advise, but I personally do not have the knowledge, so I will not opine on it. Best to talk to the doctor who has organized the liver or the kidney transplant.
Okay. So what about children below 15 years? What about their safety against COVID virus, as vaccination is not allowed for them?
See, understand one thing. Even after vaccine is taken, even after your IgG is positive, you still have to take precaution because the number of strains that we are coming, mutants we are listening to, we have to keep using our mask, keep safe distancing, keep washing hand. So for children, we would use those protection only.
Okay.
There's a question of alcohol abstinence after vaccine. No, you need not abstain from alcohol. Unless you are a person who drinks half a bottle a day, then I would say no. But a social drinking can be done. You can celebrate actually having taken vaccine.
Okay. So can a type 1 insulin dependent take a vaccine? How does it affect daily insulin doses?
It doesn't affect in any way. You have to maintain your blood sugar, monitor blood sugar, and adjust the dosage to keep your blood sugar right.
Okay. So now someone is allergic to paracetamol. Can she still take the vaccine?
Yes, she can take the vaccine. Only thing is, if she gets a headache, she'll have to take something else and not paracetamol.
Okay. So there are many reports that people die of CVA or MI after COVID vaccine.
See, those are unrelated. First report I saw that 29 adults died of after COVID vaccine. Now, death after a vaccine or after a drug. Everybody must have heard of death after penicillin injections. That is known as anaphylactic reaction. And many times that death occurs even before the doctor has withdrawn the needle. When I read that report of 29 people died after vaccine, it was from Germany. All of them were above 90 years of age. And the death occurred more than 3 days after the vaccine. So you cannot blame the vaccine for everything.
So one more question. So, sir, if anyone already has IgG antibodies positive for COVID, still they need to take the vaccine?
Yeah, because as I said, no, every time you cannot check every month, no, that how long the IgG will last. So might as well build immunity. You will have a double benefit.
Yes.
You have active as well as passive.
Yes.
There's a question of will influenza shots help kids' immunity? Now I must give you this story. About 5 years ago, we had H1N1 or swine flu, and we started giving influenza shots to people. So in the first year, we must have immunized around 450 patients in our clinic. Now, for namesake, we are giving influenza or H1N1 shots. But more than half of those patients did not visit us for the whole year. And after 1 year, they called up to say, my vaccine is due. And then they said, sir, I used to visit you every 2-3 months with cold and cough. Last whole year, I have never had cold and cough. So these shots do help somewhere. Some general immunity, some specific immunity. So I feel that you should give kids the shots as per recommendation of the pediatrician. It helps their immunity. And for all you know, see, coronavirus and other viruses are only slightly different. I'm not saying that it may help corona, but today a person's fever and cold may be due to a non-corona infection also. It will help in all of these.
So somebody has asked, if allergic to sulfa, aspirin, ibuprofen, diclofenac, what to do?
Take vaccine and pray you don't get fever and headache, because you can't take anything.
Okay.
You can take Trimazec later on. There is a question by Dr. Lalita Kedia, history of anaphylactic shock to excipients of a drug. Now, excipients of a drug, excipients of a vaccine, we have never heard. And anaphylactic shock with a vaccine, these vaccines, even in the product insert, has not been given. But yes, as a doctor, the government has said you should always have drugs available to tackle any anaphylactic reaction, because see, COVID is uncertain, vaccine is uncertain, reactions are uncertain. We are going by the best. A patient had anaphylactic reaction to unknown reason twice, now carries the EpiPen. Can she take vaccine? Then I would say let her go to a hospital and take a vaccine and give this history to the vaccinator so that they are ready in case anything happens.
So how long will COVID immunity last? He's asking.
Again, anybody's guess, but we hope that after 2 vaccines for young adults at least, because above 65, it's not that it's not effective. The data is not there. It should last at least 5 to 6 years.
Okay.
But then again, if there is no mutant coming in active.
Okay. Sir, patient has history of mastectomy and chemotherapy before 5 years and at present on tab and at trazole. Can she take the vaccine?
Yes, she can take the vaccine.
So patient who has chills with fever with influenza vaccine should be given COVID vaccine.
Can that fever and chills attributed to influenza vaccine only, or it was a coincidental finding? I would say take the vaccine, keep that thing in mind and inform the doctor when you are taking.
Okay, sir.
After first dose, can there be very late reaction running into 4th week of first dose in the form of arthralgia? No. Can take the second dose.
Okay. So how to choose between Covishield, Moderna or Pfizer vaccine?
If you can get Moderna, take Moderna. Pfizer, I am just told that it requires minus 70-degree storage. I don't know how many clinics will have that kind of facility. So I would say go with Moderna.
Okay. So these were all the questions till now.
Okay.
Yes, sir.
So Preeti, don't remove this from the YouTube.
Yes, sir.
And share the link with people on YouTube so that if they want, they can watch it again.
Yes, sir. Yes.
Thank you very much for being very nice audiences. Thank you.
Thank you, sir.
Thank you. Thank you, Preeti. Thank you, Shrita. During cough cold can take vaccine. Yes, if you have a cough cold, you can take. If you have high fever, you cannot take.
नाही दिसत आहे. बघ ना टाकून जरा. लीव मीटिंग पण दिसत नाही.